Well, you've just heard an excellent presentation by Dr. Wang. We are now in New York at the American Society of Hypertension's annual meeting, and we've been fortunate to invite Dr. Wang to join us today to discuss specific aspects of hypertension in China. Let me ask you a question that speaks to your expertise, not only in hypertension in China, but in your distinguished career. You were part of the CIS-EUR and the CIS-China studies, where essentially dihydropyridines were the major interventions to control blood pressure in patients with isolated systolic hypertension. And my recollection is that over and above the tremendous benefit of that, you and Jan Stassen observed benefits that perhaps may not have been anticipated before, if you will, a pleiotropic effect, namely a major beneficial effect on senile dementia. I'm wondering whether you can give us an update on that, because certainly I was very impressed with that attribute, because that's one of the things that our patients fear so much. And here is a class of drug that may have benefit with respect to that dreaded complication.
In the CIS-EUR study, active antihypertensive treatment was started with a calcium channel blocker, nitrosamine. In that study, Professor Forret from Paris and Jan Stassen from Leuven, Belgium, and they observed a very big reduction in the incidence of dementia. In the beginning of this study, they planned to do a trial or sub-study looking at prevention of vascular dementia. But finally, they observed a reduction in the risk of all dementias, including degenerative dementia, Alzheimer's disease, and also vascular dementia. So it means that if you use a calcium channel blocker, a antihypertensive drug, you may not only prevent stroke and cardiovascular events, you may also prevent dementia. In China, we also did a smaller study in our CIS-China trial, and we did not have power to look at the influence of nitrosamine on the incidence of dementia, but we did find active treatment started with nitrosamine prevent a cognitive decline. So we actually had quite a similar findings in these two studies using calcium channel blocker based antihypertensive regimen. And if we look at all the dementia, all the trials with dementia data in the last years, we can see a very sharp contrast between calcium channel blocker trials and trials using other classes of antihypertensive drugs. Only those trials using calcium channel blockers, especially the CIS-EUR study, and you see a very sharp reduction in the risk of dementia. So it means that probably calcium channel blockers can also prevent dementia. If we can run a bigger study to prove this, that could be very important for this aging society, because if we would expect more and more people live longer than 80 years, so many of them would develop dementia. We terribly need effective drugs to prevent or treat this very serious disease.
I mean, thank you for your comments on that. I agree fully, and whether it'll happen or not, we don't know. There are all sorts of considerations as to when pharmaceutical companies will or will not initiate studies like this, but it is so promising, it is so provocative, these findings on a dreaded disease, dementia, as we age successfully, that it would be wonderful to have a prospective study done using appropriate psychometric instruments to quantitate the benefits that occur with this intervention. And obviously, you and Jan Stassen have showed the benefits of the dihydropyridine class, not any specific drug, but the class per se in isolated systolic hypertension. So to use American slang, this will be a 2-for-1. This would demonstrate the ability to not only reduce hard endpoints, cardiovascular events, but to confer benefit as well with respect to dementia of multiple etiologies.
Yes, I fully agree with you.
In summary, I would like to thank Dr. Wang for having joined us this morning and for having shared with us this morning his expertise and his views and his vision going forward of hypertension in China. I think many of the attributes that we have heard this morning clearly differ somewhat from the phenotype, if you will, of hypertension here in the United States and in Western Europe, and they basically provide a platform for considering both future studies and rational treatment paradigms in the management of hypertension. Again, Dr. Wang, thank you so much for accepting our invitation and from traveling from Shanghai to join us this morning on the day after the convening of the American Society of Hypertension annual meeting.
Thank you very much, Mary. It's a pleasure for me to be here.